Hello, and welcome to the Summer of Health Virtual Education Sessions, hosted by the Florida Department of Health and Miami-Dade STD HIV program. During this video, we will hear from local Miami-Dade healthcare providers and organizations on 6 different community health topics. The videos will cover topics important to the community, including nutrition, STDs 101, Choose My Plate, HIV/AIDS 101, blood pressure self-management, and tobacco cessation and resources. We would like to thank our partners for joining us in putting together this series of educational videos. This video is part of the Summer of Health, Healthy Eating and HIV Awareness drive-thru food distribution event that will be held on Tuesday, June 29th, 2021 from 9 a.m. to 12 p.m. at the West Perrine Health Facility located at 18255 Homestead Avenue, Miami, Florida 33157. The Summer of Health drive-thru event is a first-come, first-serve event designed to meet the needs of the community as we enter the summer months. The first 250 cars will receive fresh produce and other goods from organizations throughout Miami-Dade County. When you watch the video, you will not only learn about important health topics, but you will also have a chance to earn extra giveaways during the event. Throughout this video, there will be a series of buzzwords following certain health topic presentations. When you see a buzzword, pause the video and write down the word. When you attend the drive-thru, bring a piece of paper with the buzzwords written on it and hold it up while online. You will then receive an extra bag of giveaways. Thank you again for joining us for this virtual education session. Enjoy.
Choose My Plate.
Learning how to choose healthy food will contribute to your overall well-being. My Plate was developed to make your selection of appropriate foods easier. One look and you can visualize what should be on your plate and in what proportion. By following the My Plate guidelines, you will feel better, have more energy, and help reduce your risk of nutrition-related health problems later in life. Let's take a closer look at the My Plate icon. First up is the vegetables group. Make half your plate fruits and vegetables. Any vegetable or 100% vegetable juice counts as a member of the vegetable group. Vegetables may be raw or cooked, fresh, frozen, canned, or dried, and may be eaten whole, cut up, or mashed. Vegetables are organized into 5 groups. This is based on the vitamins and minerals that are in them. Remember, the darker the color of vegetables, the higher they are in vitamins and minerals. Next is the fruit group. Here too, color is important. The more colors you eat, the better. Any fruit or 100% fruit juice counts as part of the fruit group. Fruits may be fresh, canned, frozen, or dried, and may be whole, cut up, or pureed. Some commonly eaten fruits are apples, bananas, and cherries. The berry group includes strawberries, blueberries, and raspberries. Next is the grain group. Make at least half the grains you eat whole grains. Any food made from wheat, rice, oats, corn, or another cereal grain is a grain product. Examples of grains are bread, pasta, oatmeal, cereal, crackers, and rice. Dairy foods can provide vitamin D, potassium, and phosphorus in addition to calcium. Switch to fat-free or low-fat 1% milk. Foods included in the dairy group are milk, yogurt, and cheese. All milk and many foods made from milk are considered part of this group. Dairy group choices should be fat-free or low-fat. Food from this group provide vitamin D, potassium, and phosphorus. However, foods made from milk that have little to no calcium, such as cream cheese and butter, are not included in the dairy group. Next is the protein group. Select a variety of protein foods to get as many health benefits as possible. The protein group includes meat, poultry, seafood, beans and peas, soy foods, and nuts and seeds. Vegetarian options in the protein foods group include beans and peas, processed soy products, and nuts and seeds. When choosing protein foods, keep your portions small and lean. Portion sizes should be 3 or 4 ounces cooked, which is about the size of the palm of your hand. When you're thirsty, water is an excellent choice to drink. It provides the fluid your body needs to keep you cool. It helps your body dispose of waste and helps circulate nutrients throughout your body. The general tip is to drink 8-ounce servings of water each day. Be sure to have water available when outdoors or doing other physical activity. Not drinking enough water can lead to overheating and dehydration. Flavored waters or vitamin waters and sports drinks usually have added sweeteners and artificial ingredients. The added sweeteners in these drinks add calories. Be sure to read the nutrition facts label and ingredients on these beverages. We all need to be active every day. Eating right and being physically active are the keys to a healthy lifestyle. It affects your mood, your brain power, and your body's ability to metabolize or burn calories. Children 6 to 17 years old should be active for at least an hour a day, and adults should aim for at least 2.5 hours a week. A main message of My Plate is calorie balance. Calorie balance refers to the relationship between the calories you get from the foods you eat and drink and the calories you use by being active. Certain foods and food components, if eaten in excess, can increase your risk for health problems later in life. These include sodium or salt, saturated fat, trans fat, added sugars, and refined grains. Knowing what is in the food comes from reading labels and requesting nutrition information when eating out at restaurants. Reading food labels help you make better food choices and build an awareness of what nutrients are in a particular food item. There is a lot of good information on a food label that can help you make a good choice. It takes a little time to get used to what to look for, but once you find where to look, it makes identifying good food choices easier. It can be easy to eat more than you want or should when you eat out. Here are some eating out ideas for getting the most of your money without getting too much added onto your waist. Always ask for water. You can also ask for the sauces on the side. Choose whole grain bread and opt for smaller portions.
The buzzword is corn.
Hello, my name is Alex Arevalo, and I'm a senior health educator at the Florida Department of Health in Miami-Dade County. Today I will be talking to you about the topics of HIV 101. This topic is very important for Miami-Dade County, as we are one of the counties with the highest numbers of new cases of HIV in the United States. So what does HIV and AIDS mean? HIV means human immunodeficiency virus. AIDS is acquired immune deficiency syndrome. HIV is the first stage, and AIDS is the latter stage. AIDS occurs when the number of CD4 cells fall below 200 cells per cubic millimeter of blood. At this stage, your body is no longer able to defend itself against opportunistic infections from bacteria, viruses, and other cancers. How is HIV transmitted? Members in our community have many myths on how HIV is transmitted. HIV is transmitted through the exchange of body fluids with an infected person, and this can occur through unprotected sex, sharing needles, especially for people that are involved in intravenous drug use, mother to child, through childbirth or breastfeeding. HIV is not transmitted through mosquito or insect bites, kissing or casual contact, toilets, or using the same dishes or silverware. So you might be asking yourself, so which ways is HIV transmitted? As we said earlier, body fluids is the main transmission method in which HIV is transmitted from person to person. And such body fluids which can transmit HIV include blood, semen, or also known as cum, pre-ejaculate, or also known as pre-cum, vaginal fluids, and breast milk. In this slide, we see how HIV progresses over time. On the left side, we see how our blood looks like before HIV infection. The purple blobs are your CD4 cells. When we become newly diagnosed with HIV, we have a high viral load, meaning the amount of virus in our blood system. And we also are more likely to transmit the virus to others during that time period. Then we enter the chronic stage of HIV infection, where the HIV virus slowly but surely starts destroying CD4 cells for replication, and in turn makes us more vulnerable to opportunistic infections. Then we reach AIDS, which is when CD4 cells fall below 200 cells per cubic millimeter of blood, where we do not have enough CD4 cells to protect us against different viruses, bacteria, and cancers. The good news is that there are many well-tolerated, highly effective treatments for people living with HIV. Many of these treatments consist of 1 pill a day and also have low side effects. Also, for people living with HIV, it is important to get into highly effective treatments because you can become undetectable, whereby the virus is no longer detected by a normal HIV test. This in turn makes you untransmissible, which means that you are no longer able to transmit the virus to others. We also have new biomedical interventions such as PrEP and PEP. PrEP is for HIV negative people, and it is a daily medication that prevents HIV infection. PEP is a medication that can be taken up to 72 hours after exposure to HIV to prevent acquiring the virus. So how does PrEP work? As we said in the earlier slide, PrEP is for HIV negative people and is a pill a day that can be taken to prevent HIV infection. PrEP has been shown to reduce HIV infection risk in multiple studies by 92% or more. When starting PrEP, it takes 7 days or more to achieve adequate levels of protection against HIV. If you stop taking PrEP and start again, you start the 7-day clock to achieve adequate levels of protection. PrEP does not protect against pregnancy or other STIs or STDs as commonly known, and is not a cure for HIV or other STIs or STDs. So you may be asking yourself, for how long do I have to take PrEP? You should take PrEP every day for as long as you want to be protected. There are several reasons why people may stop PrEP. For example, if your risk of HIV infection is reduced due to life changes, if you find you don't want to take a pill a day or forget to take it, or find that other HIV prevention methods work better for you, if the medication causes side effects which interfere with your daily activities, or blood tests indicate adverse effects on the liver or kidneys. Discuss any side effects with your healthcare provider. Another question you may have is, how fast does PrEP work? PrEP works in 7 days for rectal exposure, 20 days for vaginal exposure, and 20 days for any type of blood exposure. In an earlier slide, we also spoke about PEP. PEP means post-exposure prophylaxis. PEP is an emergency medication for HIV-negative people who have been exposed to HIV. This can occur, for example, if a condom breaks during sexual activity. It is an antiretroviral medication and has to be taken within 72 hours or 3 days from the day of exposure. PEP prevents you from getting infected after exposure to HIV by stopping viral replication. PEP should be taken for 28 days. So remember, you have to take PEP within 72 hours of exposure for 28 days. Please visit your nearest emergency room or healthcare provider to get this medication if you believe you are within the 72-hour window period after a possible exposure to HIV. There are also other methods apart from PrEP in order to prevent acquiring HIV, and these consist of barriers such as condoms, receptive or insertable condoms, and dental dams. The Florida Department of Health in Miami-Dade County has started a new program of free at-home HIV testing. This program allows residents of Miami-Dade County to order a free at-home HIV test kit to their home anonymously by visiting our website at testmiami.org. At the website, you will find a banner for the free at-home HIV testing kit program, where you can sign up, enter your details, and have one of these kits sent to your home. You can also use the camera feature on your phone to read the QR code being shown on your screen right now that will take you to the sign up page. Once we receive your request for the free at-home HIV testing kit, someone from our testing department will give you a call to verify details. Once we receive notice that you have received your free at-home HIV testing kit, we will follow up with you to see if you have any questions, and if you become reactive, we will also guide you to resources in the community in order to get you into treatment. The Florida Department of Health in Miami-Dade County has also started free HIV testing. The results are given in 1 minute. The testing is being held Mondays from 9 a.m. to 7 p.m. and Friday from 9 a.m. to 5 p.m. There's free parking available. The location of our free HIV testing program is on the mobile unit in the parking lot at our location, 1350 Northwest 14th Street, Miami, Florida 33125.
The buzzword is know your status. Getting tested for sexually transmitted infections and HIV is your first step towards identifying and treating a potential infection and staying healthy and infection-free.
Hello everyone, my name is Leyane Perez. I am a registered licensed dietitian and the Community and Wellness Dietitian at Nicholas Children's Hospital. I would like to welcome you to this short presentation on the role of fruits and vegetables in supporting the immune system. By now, everyone understands that good nutrition is essential to build a strong immune system. But what is important to emphasize is that not one specific food or supplement can protect you from illness, but the combination of nutrients that will help you build a strong immune system. I know that eating healthy is not always easy. It is estimated that 1 in 3 people in the world is suffering from hidden hunger. Hidden hunger occurs when the quality of food the people eat doesn't meet their nutritional needs. A prolonged unhealthy diet can lead to nutritional deficiencies that not only impair the immune response, but allows the infectious agent further compromise the nutritional status of the host. A balanced diet includes foods from all food groups. As you can see in the My Plate icon, half of the plate is filled with fruits and vegetables, and there's a reason for that. Fruits and vegetables are full with vitamins, minerals, fiber, antioxidants, polyphenols that are good for your health. The recommendation to consume 2 fruits and 3 vegetables a day is mainly to ensure that we consume a lot of the nutrients that we need to stay healthy. You are probably very familiar with vitamins E and C and their antioxidant properties to support our immune system. And now, I want to introduce you to quercetin. Recent studies have shown that quercetin is very effective against COVID-19. It blocks or interferes with the entry receptor that the virus needs to enter the human cell. You can find quercetin in cranberries, blueberries, blackberries, onions, and apples. The old saying, "an apple a day keeps the doctor away," takes on a different meaning in the coronavirus era. The other vitamins and minerals that are important to support a strong immune system are vitamin A, vitamin D, and zinc. Vitamin A is produced in the body by the breakdown of carotenes, the orange pigment responsible for the orange color in fruits and vegetables. Vitamin D has also received a lot of attention lately since they have found a correlation between vitamin D insufficiency and severe COVID-19 patients. Very few foods have vitamin D. Salmon and mackerel are among the best sources. Mushrooms exposed to sunlight are also good sources of vitamin D. Zinc can be found in beans, whole grains, nuts, and seeds. Thanks to technological advances, we now know more about the bacteria that live within our body and what goes inside them as well. We know that a normal bacteria community live in harmony with each other and the host, you. Anything that disrupts the normal microbiota will have real health consequences for you. The microbiome is a virtual organ with 100 trillion bacteria and 500 trillion viruses and fungi, all producing chemical metabolites that drive our immune system and digestive health. Gut bacteria have very important metabolic functions, and each have the potential to create toxic metabolites or waste depending on what they eat. Eating more fruits and vegetables and fiber supports a healthy gut microbial community. So as you can see, eating more fruits and vegetables is not only better for you, but for your bacteria as well. Probiotics are the good bacteria that is naturally found in our gut or in some foods such as dark chocolate, yogurt, and other fermented foods. Prebiotics are the non-digestible food components that promote the growth of healthful bacteria, such as bananas, onions, garlic, and beans. Having a variety of dietary fibers, both soluble and insoluble, in the diet supports a healthy gut microbial community. Soluble fiber is found in beans, fruits, and vegetables. And good sources of insoluble fiber are whole grains, nuts, beans, and vegetables. In conclusion, eating more fruits and vegetables prevents you from many chronic diseases and supports your immune system to help you combat illnesses. It is never too late to start eating healthy. A small shift in your diet to include more fruits and vegetables will have a significant impact in your health. This concludes my presentation. I hope I leave you inspired to eat more fruits and vegetables. Make every effort you can to eat a fruit or a vegetable with every meal and snack. Remember, every time you eat is an opportunity to do something good for your body. Take care.
When you see a buzzword, pause the video and write down the word. This buzzword is oranges. Hello, and welcome to this presentation on STDs 101, presented by the STD HIV Prevention Unit with the Florida Department of Health in Miami-Dade County. Today we will discuss STD prevalence, common types of STDs, ways to prevent STDs, and where to get tested and or treated for STDs in Miami-Dade County. Let's get started. What are STDs? Sexually transmitted diseases, or STDs, are very common diseases spread through sexual contact. STDs are passed from one person to another through sexual activity, including vaginal, oral, and anal sex. They can also be passed from one person to another through intimate physical contact, such as heavy petting, though this is not very common. STDs are preventable through a few easy steps. If you are sexually active, know how to protect yourself and your sexual partner from STDs. What happens when I get an STD? Up to 80% of people with an STD will have no or very mild symptoms for many months, such as slight burning or cloudy urine. The only way to know if you have an STD is to get tested. If you are diagnosed with an STD, know that all can be treated with medicine and some can be cured entirely. There are several types of STDs. The first are bacterial STDs, including chlamydia, syphilis, gonorrhea, bacterial vaginosis, and others. Chlamydia is a common STD that can infect both men and women. It can cause serious, permanent damage to a woman's reproductive system. This can make it difficult or impossible for her to get pregnant later on. You can get chlamydia by having vaginal, anal, or oral sex with someone who has chlamydia. Most people who have chlamydia have no symptoms. If you do have symptoms, they may not appear until several weeks after you have sex with an infected partner. Women with symptoms may notice an abnormal vaginal discharge and a burning sensation when urinating. Symptoms in men can include a discharge from their penis, a burning sensation when urinating, and pain and swelling in one or both testicles, although this is less common. Syphilis is a sexually transmitted infection that can cause serious health problems if it is not treated. Both men and women are at risk for contracting syphilis by direct contact with a syphilis sore during vaginal, anal, or oral sex. Syphilis can also spread from an infected mother to her unborn baby. Syphilis is divided into 4 stages, being primary, secondary, latent, and tertiary. There are different signs and symptoms associated with each stage. Finally, gonorrhea is a sexually transmitted disease that can infect both men and women. It can cause infections in the genitals, rectum, and throat. It is a very common infection, especially among young people ages 15 to 24. You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. Also, a pregnant woman with gonorrhea can give the infection to her baby during childbirth. Some men with gonorrhea may have no symptoms at all. However, men who do have symptoms may have a burning sensation when urinating, a white, yellow, or green discharge from the penis, and painful or swollen testicles, although this is less common. Most women with gonorrhea do not have any symptoms. Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. Women with gonorrhea are at risk for developing serious complications from the infection even if they don't have any symptoms. Symptoms in women can include painful or burning sensation when urinating, increased vaginal discharge, and vaginal bleeding between periods. There are also viral STDs such as genital warts, also known as HPV, herpes, hepatitis B, HIV, Zika, and others. HPV is the most common STD. Both men and women can get HPV by having vaginal, anal, or oral sex with someone who has the virus. In most cases, HPV goes away on its own and does not cause any health problems. But when HPV does not go away, it can cause health problems like genital warts and cancer. There is a vaccine for HPV, and the CDC recommends HPV vaccinations at ages 11 or 12 and for everyone through age 26 years old. Genital herpes is an STD caused by 2 types of viruses. The viruses are called herpes simplex virus type 1 and herpes simplex virus type 2. Both men and women can get genital herpes by having vaginal, anal, or oral sex with someone who has the virus. Genital herpes is very common in the United States. More than 1 out of every 6 people aged 14 to 49 years old have genital herpes. Most people who have genital herpes have no symptoms or have very mild symptoms. Herpes can cause painful genital sores and can be severe in people with suppressed immune systems. Hepatitis B is a vaccine-preventable liver infection caused by the hepatitis B virus. Hepatitis B is spread when blood, semen, or other body fluids from a person infected with the virus enters the body of someone who is not infected. This can happen through sexual contact, sharing needles, syringes, or other drug injection equipment, or from mother to baby at birth. Not all people newly infected with HPV have symptoms, but for those that do, symptoms can include fatigue, poor appetite, stomach pain, nausea, and jaundice. For many people, hepatitis B is a short-term illness. For others, it can become a long-term chronic infection that can lead to serious, even life-threatening health issues like cirrhosis or liver cancer. HIV and AIDS 101 will be covered in a separate portion of this educational sessions. Parasitic STDs are caused by parasites passed between partners during sex. Common parasitic STDs include pubic lice, also known as crabs, scabies, trichomoniasis, and others. Also called crab lice or crabs, pubic lice are parasitic insects found primarily in the pubic or genital area. Signs and symptoms of pubic lice include itching in the genital area and visible nits, also known as lice eggs or crawling lice. Pubic lice is generally spread through sexual contact among adults. Human scabies is caused by an infestation of the skin by the human itch mite. The microscopic scabies mite burrows into the upper layer of the skin where it lives and lays its eggs. The most common symptoms of scabies are intense itching and a pimple-like skin rash. The scabies mite usually is spread by direct, prolonged skin-to-skin contact with a person who has scabies. Trichomoniasis, or trich, is a very common sexually transmitted disease. The trich parasite passes from an infected person to an uninfected person during sex. Although symptoms of the disease vary, most people who have the parasite cannot tell they are infected. Trichomoniasis can increase the risk of getting or spreading other sexually transmitted infections. Having trichomoniasis can also make it feel unpleasant to have sex. Without treatment, the infection can last for months or even years. Finally, STDs can also be spread via fungus. Candidiasis, or a yeast infection, is a common STD caused by fungi. It is found in both men and women, but is more commonly seen with women. The symptoms of yeast infection in women include vaginal itching or soreness, pain during sexual intercourse, pain or discomfort when urinating, and abnormal vaginal discharge. Although most yeast infections are mild, some women can develop severe infections, including redness, swelling, and cracks in the wall of the vagina. How to prevent STDs. Physical barriers such as condoms, receptive and insertable condoms, and dental dams are highly effective means of preventing STDs. Use one of these barriers every time you have sex and with every partner. Visit testmiami.org to receive a free personal protection kit, which consists of male condoms, lubricants, and educational materials on condom use, protection from STDs, and positive sexual health. There are other ways to reduce the chances of contracting an STD. Per the CDC, abstinence is the most reliable way to avoid STDs. This means avoiding all oral, vaginal, and anal sexual contact with other partners. Mutual monogamy, or committing to having sex with only one person, is another highly effective means of preventing STDs. Being in a long-term, mutually monogamous relationship with an uninfected partner is one of the most reliable ways to avoid STDs. But you must both be certain you are not infected with STDs. It is important to have an open and honest conversation with your partner about your sexual health. For those who are sexually active and not in a committed relationship, reducing your number of sex partners can decrease your risk for STDs. It is still important that you and your partner get tested and that you share your test results with one another. Knowing your STD status is a critical step to stopping STD transmission. If you know you are infected, you can take steps to protect yourself and your partners. Be sure to ask your healthcare provider to test you for STDs. Asking is the only way to know whether you are receiving the right tests. And don't forget to tell your partner to ask a healthcare provider about STD testing as well. Many STDs can be easily diagnosed and treated. If either you or your partner is infected, both of you need to receive treatment at the same time to avoid getting reinfected. To book an appointment at one of the Florida Department of Health and Miami-Dade County clinics, please call 305-575-3800. In our STD PrEP clinics, we can provide services to individuals 13 years of age and older and to all who reside and visit Miami-Dade County. Eligible persons may qualify for free or reduced cost of service. Proof of income is required during income determination. Service will not be denied due to a patient's ability to pay, immigration or citizenship status, race, religion, or sexual orientation. Once again, for an appointment with the Health District Center or West Perrine location, please call 305-575-3800. If you are interested in requesting our educational services, please call 305-643-7420 or visit testmiami.org. Thank you for joining us for this video, and remember to be safe and get tested. This buzzword is PrEP. PrEP, also known as pre-exposure prophylaxis, is a daily pill that can help prevent HIV infection. When taken as prescribed, it can lower your risk of HIV infection by sexual contact by up to 98%. Ask your healthcare provider for more information.
Blood pressure self-management. On this slide, we will explain what blood pressure and high blood pressure are, as well as what can put you at risk. What is blood pressure? Blood pressure is the force of blood pushing against the walls of your arteries. Blood pressure rises and falls throughout the day, but can damage your heart and cause health problems if it stays high for a long time. What is high blood pressure? High blood pressure, which is also called hypertension, is blood pressure that is higher than normal. High blood pressure increases your risk for other health problems such as heart disease, heart attack, and stroke. To find out if you are at risk for high blood pressure, you need to consider if you have any other health conditions like diabetes, your activity, and the foods you eat, and also your family history. These can either raise or lower your risk for high blood pressure. You can take steps to lower your risk by changing the things you can control, such as eating healthy, being physically active, quitting smoking, and limiting alcohol. Let's talk about what the numbers mean. Blood pressure is measured using two numbers. The top number, also called systolic blood pressure, measures the pressure in your arteries when your heart beats. The bottom number, or diastolic blood pressure, measures the pressure in your arteries when your heart rests between beats. Here are some general tips for taking your blood pressure at home. Use a notebook or a mobile app to keep track of your blood pressure readings. Take your blood pressure at the same time every day. Take at least 2 blood pressure readings, 1 or 2 minutes apart. If you find that your blood pressure reading is above normal, talk to your healthcare provider. They can help you make a plan to manage high blood pressure. Take steps to improve your lifestyle. Living a healthy lifestyle can help keep your blood pressure at a healthy range. Here is the chart showing the different categories for a blood pressure reading. You can see that a normal blood pressure reading is less than 120 for the upper number, or systolic, and less than 80 for the lower number, or diastolic. Any blood pressure reading higher than 120 and 80 should be evaluated by a medical provider. Let's review the correct way to measure your blood pressure. Before you take your blood pressure reading, you should not drink or eat 30 minutes beforehand, and you should empty your bladder. During the blood pressure reading, do not talk. Rest your arm at chest height. Use the cuff against your bare skin. Make sure your back is supported, and sit with your feet flat on the floor. There is a healthy diet eating plan with a proven record of helping people lower their blood pressure, which is called the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This plan recommends you eat more fruits and vegetables, whole grains, fish, poultry, beans and nuts, fat-free skim or low-fat milk products, and foods rich in potassium, magnesium, calcium, protein, and fiber. This plan also recommends eating less red meats and added sugars, sodium or salt, saturated fat, cholesterol, and trans fat. Let's talk about a healthy lifestyle, which can help you keep your blood pressure at a healthy range. Being physically active is one of the ways you can improve your health. Physical activity improves brain health, helps you maintain or lose weight, prevents some cancers, lowers blood pressure, improves cholesterol levels, and reduces the risk for type 2 diabetes and can help control your blood sugar if you already have diabetes. When it comes to physical activity, choose activities that you enjoy. Exercise to a workout video, take a nature walk, get your friends and family involved. Along with making lifestyle changes, doctors may prescribe medicine to help control blood pressure. Blood pressure medicine reduces excess water and salt in your body, relaxes your blood vessels, it makes your heart beat with less force, and lowers your risk for heart disease, heart attack, and stroke. Most often, blood pressure medicines do not cause side effects. However, some people may experience dizziness, headaches, swelling of the legs or feet, and stomach problems. Although the risk of taking blood pressure medicines are low, all medicines have risks. Talk with your doctor about the risk of blood pressure medicine or any side effects you may experience. Here are some tips for taking blood pressure medicine. Take your blood pressure medicine exactly as prescribed by your doctor. Do not stop taking your current blood pressure medication without talking to your doctor or pharmacist first. And keep a list of your medicines to help you remember the name, dose, frequency, and special instructions. For more information, visit www.cdc.gov or www.heart.org.
This buzzword is salad.
Hello everyone, I hope you're all staying safe and doing well. I am Nikki Chuck and I am a senior health educator with the Florida Department of Health in Miami-Dade County. I work in the Tobacco Prevention and Control Program, and today I will be presenting on available tobacco cessation resources. The information provided will be able to help you learn a little bit more about the importance of living a tobacco-free life and the tools available to help tobacco and nicotine users quit. I want to share some interesting tobacco facts. Tobacco use is still the leading cause of preventable death in the world, killing approximately 6 million people annually worldwide, 480,000 people annually in the United States, and some local data, tobacco use kills approximately 32,300 people per year in the state of Florida. Next, here are some additional facts about tobacco use and how it impacts the human population. As previously mentioned, 480,000 Americans die annually from tobacco use, which is about 1 in 5 deaths. There is no risk-free level of secondhand smoke exposure, and even brief exposure can be very harmful to your health. And lastly, for every person who dies from tobacco use, at least 30 people live with a debilitating smoking-related illness, according to the CDC, and these facts are all very impactful to the human population. Smoking and tobacco use impact health negatively and cause many diseases, including the following: cancer, heart disease, stroke, lung diseases and cancer, diabetes, chronic obstructive pulmonary disease or COPD, including emphysema and chronic bronchitis, poor wound healing, among many other health issues. In addition, secondhand smoke is also associated with ear infections and asthma attacks, especially in children and infants, as well as sudden infant death syndrome, or SIDS. Next, I would like to share some proven successful ways to quit. We do not recommend quitting cold turkey, but instead encourage all smokers and tobacco users to quit using the available quit options through Tobacco Free Florida and local resources. I want to stress that medication is highly effective with helping tobacco users to successfully quit, and since many people respond differently to medications, it makes sense to ensure that smokers and tobacco users have access to different choices when they are trying to quit. This table shows the 5 types of nicotine replacement therapy, including the most common patch, gum, and lozenge, and the 2 prescription medications commonly used to support cessation attempts. All 7 medications are approved by the FDA to treat tobacco addiction, which means that they are safe and effective. In the next few slides, I will share more information about available cessation programs that also offer free nicotine replacement therapy for all participants. Here is some encouraging data. 70% of tobacco users do want to quit. Half of them make a serious attempt each year, and 80% see a healthcare provider each year, which is very great news. On the slide, you will see information about free cessation and quit resources available. There are 2 main organizations that provide free cessation services: AHECs, or Area Health Education Centers, and Tobacco Free Florida. We have 2 AHECs here in Miami-Dade County, Miami-Dade AHEC, as well as the University of Miami AHEC, and then of course Tobacco Free Florida offers their Quit Your Way program. Tobacco Free Florida's Quit Your Way program offers 4 options for you to quit. You can select the one that works best for you based on your preference, which is why the program is titled Quit Your Way. There is the phone quit option, which is done through the telephone through a quit coach. There is the group quit option, where participants can work in a group setting virtually so that they can quit together. The web quit option, which is done all online through their portal. And lastly, more quit tools, which offers tools such as email and text to help you on your quit journey. For tobacco users looking for a proven effective way to quit, the best plan is to talk with their healthcare providers or seek help from an evidence-based resource such as Tobacco Free Florida's Quit Your Way program. For more information, please visit www.tobaccofreeflorida.com/quityourway. The AHEC program offers two class types, the Quit Smoking Now curriculum and the Tools to Quit curriculum. Both are offered in English and Spanish and were created based on clinical practice guidelines. The Quit Smoking Now is a 4-week course, whereas the Tools to Quit curriculum is a 2-week course, and both are offered virtually via Zoom and include free nicotine replacement therapy. For additional local resources, please contact the Florida Department of Health in Miami-Dade County Tobacco Prevention and Control Program at 305-278-0442. Here are some additional cessation resources for you to review. Here are the references for some of the slides at the beginning of the presentation. Thank you all for your attention. If you need anything, please feel free to contact me at my email and phone number listed. Have a wonderful day.
The buzzword is U equals U. U equals U means undetectable equals untransmittable. U equals U means that people with HIV who achieve and maintain an undetectable viral load, the amount of HIV in the blood, by taking antiretroviral therapy daily as prescribed, cannot sexually transmit the virus to others. As a reminder, please remember to write down the 6 buzzwords in today's video on a piece of paper and hold the paper up while you are in line at the Summer of Health drive-thru food distribution event on Tuesday, June 29th from 9 a.m. to 12 p.m. at the West Perrine Health Facility located at 18255 Homestead Avenue, Miami, Florida 33157. You will then receive an extra goodie bag of giveaways. We would like to take a moment to thank all of our partners who joined us in putting together this video of community health education videos, as well as the drive-thru food distribution event. Thank you all for joining us.